Okay, good deal. All right, and I guess Sonia, if you arrive, please buzz in or help me know that you're alive and well and with us. This gives me limited control. And that's okay. I don't have to be in control. Here we go. Okay, let me get this going. Nice. How was your week?
It wasn't good. Wasn't really good, but I'm just glad to be alive.
Yeah, you made it through the snow.
Yeah.
Is there still a lot of snow on the ground there in Alva?
Not that much. It's melting now.
Okay, okay.
Yeah.
We had quite a bit in Enid too. We had to cancel school Tuesday. So
Yeah, they did cancel classes over here too on Tuesday.
yeah, I thought so.
Yeah.
Okay. I'm going to start with, I've got motivational interviewing on tap tonight, and this will be something that you use all the time. You will utilize this. I can say that I've utilized this in every therapy session that I've done, and so it's a very generalizable, malleable. You can basically make this technique work in a variety of settings for a variety of clients, whether they're whether they suffer from addiction or not. I mean, you're going to be able to use this. So this will be something very practical for you tonight, something very hands-on, something for you to consider in your class project to do. You're welcome to do motivational interviewing and demonstrate it. It's not that difficult, but yet it takes a little bit of thought. It's a little bit. I'd say it's a step up from Rogerian, just straight reflection, client centered. You're wanting the client to get somewhere. I know Carl Rogers is too, but you're helping them along in the process by using. You've got to be quick on your feet. A lot of times with motivational interviewing, you have to be one step ahead. Or attempt to be anyway. So that's where we're going to go. Before we get there, I'd like for us to be familiar with the stages of change. So the stages of change is a concept by Miller and Rolnick, and that's something that you could be tested on. The people that, of course, came up with the theory, and the motivational interviewing goes right along. Oh, excuse me, I've got this backwards. Miller and Rolnick came up with motivational interviewing, and a person by the name of Prochaska, and I'll give you the spelling on that later, came up with the stages of change. And so let me see if I can pull something up on the internet to help us with stages of change. So you can see what popped up very quickly was stages of change in addiction. However, you could use stages of change in many facets of therapy. If you're looking at someone with, especially with, I've seen this applied with women that are in domestically violent situations, looking at the stages of change in application there. You could actually try to apply this with somebody with an anxiety disorder or a depressive disorder, where you would think about, okay, what stage of change are they in? And that's going to actually modify and help you help dictate what mode of therapy and where you're going to go with therapy. It's going to allow you to have a roadmap because sometimes I'll admit I'm guilty of this too. Sometimes you'll just get into a habit once you start practicing in the field of just kind of chatting with people. Hey, how's it going? How's it going this week? What's going on? What's new? Because that's natural, and we do want some of that, because if we're too dry and we're too theoretical, people aren't going to come back and talk to us. So some of that is good, but you also want to have like a roadmap, like some sort of strategy that's going to guide you through this. So having this framework will help you. Having this, I use this in several areas of counseling too. So without further ado, let's look at stages of change and what that looks like. So I'll post, because we're not getting a video tonight, I'll go ahead and post one of these for our resources. Let me see if I can make this a full screen. So here's how, and they've got this misspelled. It's not Prochaska, it's Prochaska, Pro, and it is Di Clemente. So the 5 stages of motivational readiness to change. Actually, if you're looking at someone that is going to be treated in the drug court system or in Oklahoma for substance use, they actually have to go through a stages of change assessment. Okay, so here are the 5 stages. And they're very self-explanatory. What I like about this, it's not real difficult to figure out. So let's take, for instance, let's take, for instance, that we have a person that came to see us and they are smoking a lot of marijuana. Okay, let's say I'll use someone that's fairly recent on my mind. I staffed a person that was in trouble. Somebody came to me with this today. Their employer had a random UA, and this employee came back with a positive UA, and it was positive for marijuana. So what would you do as an employer if you had someone that tested positive with marijuana on a UA?
I think I'm gonna have to talk to him about the results.
Absolutely. What this employer decided to do was decided to send him for an assessment. And so we did an assessment. This is not the Advanced Addiction Studies class, so we won't get into assessments too much. But we did an Addiction Severity Index and a SASI, which is a Substance Abuse Subtle Screening Inventory, which kind of is a long true-false questionnaire, which can, if somebody's being defensive, it'll still sometimes pick up if they're using substances. And it'll also tell you if they're being defensive. So we gave this guy a couple of these things, and he was pretty honest. He came out and said, yeah, I smoke 3 joints a day. Well, do you smoke at work? No, I don't smoke at work. Well, when do you smoke? I smoke right when I'm leaving home. I smoke during lunch, and I smoke after I get home. So right there, what are you picking up? Did you pick up any discrepancies in that description right there? Lauren, what was the discrepancy there?
Well, he said he didn't smoke at work, but he still smoked previous to, so it's still affecting.
Yeah, he's still high.
Yeah, at work. I mean, it's still,
Right.
on his lunch break and everything else. I think that's still.
Yeah.
Yeah, so he's definitely got a little clouded perception. And like the counselor that staffed this with me is do people that smoke a lot, do they walk kind of around like in their own little cloud, or is, well, somewhat. I mean, we'll talk about that, but yeah. So he's not seeing that it's much of, he goes on and talks to her a little bit more, and it helps me deal with stress at work. I get really stressed out, and so I go and I do a better job, after I smoke. I'm not as stressed. So
Is it a stressful job?
it is a stressful job. This person had a stressful. I can't go into too much detail for their confidentiality, but so if you were looking at this 5-stage model, which goes into pre-contemplation, contemplation, preparation, action, and maintenance. At what stage of change already, and you see you've never used this model before, but what stage of change would you say this individual is operating in regarding his use of cannabis? Absolutely, Lauren, yeah. Yeah, he is definitely in pre-contemplation. He is not thinking. So pre-contemplation, a person is not thinking about changing. And this is something that will definitely transcend into all areas of our family counseling and addiction. Okay, this model right here. So for those of you listening on the tape recording of this too, I will post this stages of change on the web on Blackboard. This is something to be very familiar with because this will help you. If you have a family member that comes in that's complaining, my son, they're smoking so much marijuana, or my daughter, she's drinking heavily on the weekends. I don't know what to do. She seems like she's out of control. You'll want to assess what stage of change that loved one is in, or if you have the client, if you have the client, the addiction, the client with addiction yourself, that's going to help you know how to change that family dynamic. If you have someone that's in a preparation or an action stage, you're going to treat that person a whole lot differently than you are this person who has a family, who's caring for a young child and also a spouse. But yes, this person smoking 3 joints a day, not really perceiving any harmful effects from it, not even perceiving that it's affecting his work in a negative way, which we can debate that, but he's definitely in a pre-contemplation stage, not thinking about it. It's an easy way to think of it. So if you were to approach this person and think about is this person in contemplation? I know this is this first time you've ever been exposed to this model, but it's very straightforward and logical. If this person was in contemplation phase, what kind of things would you expect to hear from him while he's talking to us?
He's trying to change, but it's hard for him to.
Yeah. He might say something like, and he did say some of these things to our clinician. He said, well, I think maybe, and this is towards the end of the session, do you think maybe I have ADHD? And so our person says, why? Why do you think you have ADHD? Well, because I'll start a bunch of things, but I don't get them finished. Like I started painting a couple rooms in my house, and I don't know, I have a hard time getting them done, and I started just working on my kitchen sink, and I still haven't got. Do you think maybe I could have ADHD or something? So those of us that are not even in the field, what are you thinking about when this person? I mean, you're in the field, you're in school, but what are you thinking about as I'm telling you his attribution here that he's got some ADHD?
He's trying to blame the ADHD for whatever he's not willing to change.
Yeah,
I guess. And it seems like he doesn't really want to address the joint issue. He's more concerned with the ADHD than what really got him there in the first place.
One thing that our person did point out, and she was a little more confrontive than a motivational interviewing technique because she was just doing this assessment. So she goes, So marijuana is associated with amotivational syndrome. So if you don't have the motivation to complete these projects, do you think maybe that might have something to do with it? So he just kind of smiled as he walked out with that. But yeah, that's you might say. So if he were in contemplation stage, he might say, you know, I think I'm not getting my projects done because I just don't have enough energy after I smoke all day. That's someone, they're recognizing some consequences. They're recognizing negative consequences. Here, down here, they're just recognizing positive consequences. All they see is the positive. Down here, up here in the contemplation, they're recognizing negative, and they're thinking about changing. You know, they're not doing anything about it yet, but you know, if you had a person that in session says, you know, I need to cut back from 3 joints a day to 2. Maybe if I just smoke like in the morning and then at lunch, I don't have to smoke, you know, or maybe if I just smoke at night to put myself to sleep. You know, they're thinking about change. That's somebody in contemplation. And I'll use the triangle to represent change. All right, so by virtue of just going in elimination, it's a very easy model. You guys are going to get this, and it'll be 100% on the test, and it's something that you'll always use. Preparation, if Lauren, if you're thinking about this guy might be in preparation, what kind of things would he be saying?
I don't know. I was gonna say the same thing that we just said about the contemplation, as far as like maybe limiting amount, or maybe he does limit amount. I don't know.
Yeah, exactly,
That one.
exactly.
That's me. Now, would that be action, or would action be limiting? All of
Action,
it?
action would be he's
Limiting.
actually taking steps.
Okay, so.
Actually, stop smoking as much. So.
Okay,
you
so
know,
preparation would be him considering just that he cuts out morning and noon and.
I'll put actually decreased use. And so you're right. So preparation is him talking with you about, and so think about that SMART acronym, you know, specific, measurable, attainable, realistic, time-oriented. Think about if you're helping somebody prepare, what are you going to help nail him down with?
Well, you know, how much less are you going to use?
Yes, exactly. You just did.
How many times you're going to use?
You know what you're doing right now?
Quit using.
You're doing motivational interviewing by asking that. That is motivational. Because you're not giving it to him. You're asking him, well, so how much are you going to cut down? You know, what does that look like? So that is the preparation stage. So this is going to be very logical. You're going to be very comfortable with motivational interviewing. Preparation is making plans. That's about the easiest way I can. Making plans or goals. And I'll stress goals because that'll give us that SMART acronym that we can help them, you know, make those goals that are actually going to make a difference. And then, so last but not least, I won't put Lauren and Nice under stress. Last but not least, we have maintenance. And so maintenance, again, is very self-explanatory. There's nothing hidden or really cryptic about this. Maintenance is they've made changes and they're sustaining changes. Sustained change. Actually decrease, so this model is not rocket science, but it is very, very useful because it helps bring you, puts your feet on the ground and helps you interact with this person and know where to go. So this model is actually going to guide us in our motivational interviewing and in our overall counseling. Any questions about the stages of change? It will, again, this will come back up, and so you'll get practice as we implement some motivational interviewing. All right. But to parlay this, I don't want to leave it too quickly here. So thinking about someone that, say, is in a domestically violent relationship, this is definitely 100% applicable to addiction. But thinking about somebody, again, we went over all of the things that kind of coincide with addiction. And so volatile relationships definitely go in there with that. If you're talking to someone about being in an abusive relationship, how would this model? I'll go ahead and it's up there. How would this model apply to someone that is in a domestically violent or abusive relationship?
I think it's gonna help them understand, or like at the first stage, acknowledge that they are being abused and they need to get out of it. Because most often they don't really get to recognize that it is a problem until it's too late. So at the pre-contemplation stage, although they may not be able to recognize it as a problem, it is a stage where the therapist can be able to work with them to let them see that it is a problem, to a point where they can get to the contemplation stage where they get to see that yes, it is a problem and I need to get out for my own safety or the safety of the other person. And then from there be able to probably find a way of making, okay, do we need to get you to a shelter, or
Yes.
do you have another house where you can live? And then be able to work with her on the things that she may need to do as a person who's living now by herself and things like that. And from the final stage will be helping her to learn how to maintain where she is as an independent woman or man, whoever they abused will be.
It's normally an abusive man, more 9 times out of 10. So, very nice. I'm very impressed. That was comprehensive and succinct and to the point. See, you've got it. You've in the 5 minutes we've been here, you applied the model to a completely different situation. And I don't have any corrections for that. That's right on. So good job.
Thank you.
Yes. So you can see that you can put this model on anxiety. You could put this model on depression. Very easily put it into use with someone that's in a domestically violent relationship. Getting them into recognition of it being a problem. A lot of times, folks that are in domestically violent relationships take responsibility themselves. It's my fault. It's because that's part of the tactic of the abuser in that relationship. So it's very powerful, and the motivational interviewing goes hand in hand with that. So yes, very very good, very astute. So we'll move on because that's a sign that we have it. Okay. Any questions from anyone? Okay. Okay, so we're going to jump right into motivational interviewing. Okay, so jumping into this, just by very definition, what do you think of with the terms motivational interviewing? What does this infer that you're doing?
That you have a motive, that you're trying to get something specific, get to something specific in talking with them.
Absolutely. So you're working to increase their motivation. You've got something specific, like you said with our example tonight of the gentleman with the three joint a day, 7 days a week habit. Rogerian would be strictly reflecting where he's at. Motivational interviewing is a step forward in that you're wanting to compel him toward changing motivation. Motivational interviewing. So, interviewing, when you're interviewing someone, what are you doing? I'm interviewing you guys right now, you ladies right now. What am I doing?
Trying to get us to talk.
Exactly. Yes, by asking questions. Yeah. I am interviewing you, and so typically think about a reporter. If you're interviewing someone, you're trying to get them to talk. What has been shown to be effective about this model, where the promise and the evidence base is, it's with when someone can verbalize, can speak that they themselves want the change to happen. When somebody speaks that for themselves, it's more likely to happen than someone telling them what to do. So that is the idea behind motivational interviewing. You are trying to get them to say for themselves what you really want to tell them. And so I've had therapists get in and this will save you. This will save you in your techniques. I've had therapists get caught in a trap of just simply giving advice. If we simply give advice, we may be considered the experts, but how often are our clients going to take our advice?
Probably not very often. Not to mention that it could always come back on you as well. I tried this and this didn't work, or I tried that and now you're responsible for how it turned out.
Nice, exactly.
Not a good idea to do it.
It decreases ownership. If the person speaks to it themselves, the client, they've owned it. You don't own it. It's theirs. So it's kind of like you're playing a Jedi mind trick with someone to a degree, without explicitly saying it. So we'll get a feel for this. Here's how sessions should feel. You should be evoking information from someone, collaborating with them, and the person should have autonomy. That's a strong word, especially for somebody that's mandated to treatment. I almost got into an argument with one of our providers for drug court. I was really advocating for our people to have more autonomy because in the drug court, they're going to have consequences. It's not just like the guy that was an employee of a company that got a UA. If a person fails a UA in drug court, they could go to jail. If they continually fail, they could go to prison. So, to me, when you're counseling somebody, that's not for us to step on. That's the jurisdiction of the court. If we're counseling somebody, we're just simply asking them, where are you at today? Where are you at with your use? And that's a legitimate question in motivational interviewing. So you want autonomy, but you also want to provide support. So you could use the acronym there, ACE, autonomy, support, collaboration, and evocation, even though I have it backwards. But ACE would be a good acronym for a test. Here are some of the motivational interviewing principles. So it's okay to express empathy. So nice, let's say that you're the person that came. I know you're not for real, but let's say you're the person I was referring to that was smoking the 3 joints a day, and you came in and you came in and you were moving up the stages in that you went from pre-contemplation to contemplation, and you said, I'm just not getting things done around the house. I tried to paint a couple of rooms. I got started and I didn't get finished. So if you're expressing empathy, Lauren, how would you express empathy to Nice?
With her not getting things done around the house.
Yes. It's really bothering her. It's really bothering her. She's got a lot of anxiety over it.
That
It's tough.
But I'm sure that it, well, I don't know. I'm sure that it does bother you. I'm sure that it does bother you. I don't know.
Okay, well, it's somewhat tough to express empathy for someone that we don't have empathy for. So that's kind of where I was going with the trauma.
I was going to say because he's, I don't know. It is hard to have empathy in this particular case because I'm sorry that you.
Okay.
Without bringing up his.
Without bringing up his use.
Actually, I have something unpainted, and I don't even smoke pot. So that's,
well, you could say that.
It is hard to paint because I have stuff at home that is unpainted, and I don't even.
That's okay. See, that's good. See where you went right there.
Yeah,
we don't always want to rely on self-disclosure,
right.
but that's
I wasn't disclosing too much.
Yeah, in that case, it's not about you. It was about you understand, because empathy is just about understanding where they're coming from.
Right.
I understand.
That's why I was hesitant to go there at first because I didn't know because of the self-disclosure, but it wasn't too much. So.
No, that's okay. That's okay. We're just wanting to see what we're doing here is we're getting rapport, okay? Because what somebody that's got a substance addiction, addiction problem, whatever the addiction problem is, they're expecting to be beat down in counseling. They're expecting to somebody come in. Because honestly, you watch Intervention. Have you guys ever seen that show, Intervention?
Are you talking like Dr. Drew?
Well, it could not necessarily Dr. Drew, but Dr. Phil there's a show on A&E. It was on a few years ago called Intervention, and it was you're going to rehab. There's people telling them what they are going to do. This is not that technique. You're not telling somebody what to do. So expressing empathy, nice. Yeah, I've got a few things that I haven't got painted too. Sometimes it's kind of frustrating to not get things done. That's okay. You don't have to agree with them. You just know what they're going through. But how did that make you feel that, I kind of understand what it's like not to get things done?
Comforting at least that I'm not the only one who doesn't get things done and frustrated with it.
Yes, so you don't feel like you're alienated in the session. You don't feel like, well, this person's judging me. This person's listening to me. Now, after you do that, now this one you do want to kind of keep in order. You express empathy. In fact, I would change the R. I wish I would have redone this. You do want to, at some point, develop discrepancy. In other words, so like the guy with the 3 joints, our counselor attempted to develop discrepancy by stating the obvious, which is marijuana affects motivation. So if you were asking questions in a little different way than what she did, how would you develop some discrepancy?
To the guy?
To the guy, yeah, with the 3 joint a day. To Nice. Sorry. I'll stop.
Is this her too, or just me?
Well, it can be both.
Okay.
It can be both.
tend to be pretty forward too, though, sometimes.
Okay.
I probably would have just, thinking about an actual client I had, that I, not drug problems, but just other issues as far as diet.
Diet. That would be a good one for
I mean,
motivational
he
interviewing.
continually doesn't stick to something.
Mm-hmm.
He knows he should, because he has, his doctors told him he should. I mean, he's going to kill himself.
Significantly overweight. He's
And
obese.
so he comes in and
Okay.
tells me he's scared of dying. And I'm like, but you're not that scared of dying because you continue to do it.
That's pretty
I mean,
confrontational.
no, not
for,
that scared of
for
dying. I'm
MI.
saying- I know, I
But-
tell him, I'm sorry.
No.
I told him, you tell me you're scared of dying, but you don't make any changes to do
Ooh,
that.
perfect.
So you're
Yes,
telling
yes.
me one thing, but you're also doing a different.
You're
So I
reflecting.
mean, I call him out on it like that.
That's very good. So as long as you don't say, point blank, okay, so motivational interviewing, at one point you reflect. So you're
It is
telling me
practice.
you want to change and you're afraid of dying, yet you continue to eat a lot. Well, help me make sense of that. That would be a good, really, especially once you've got the rapport with him. I'm assuming you've
Yeah.
got rapport with this guy.
Yeah.
Okay.
A lot. I didn't
Yeah.
do that in the first session.
Right. This really is common. It's a common sense type of method. It works. So yeah, develop discrepancy. Nice. You told me that that you're having trouble getting the rooms painted. Tell me a little bit about so what I would do is I would dig a little bit. Tell me a little bit about what's keeping you from getting those rooms painted.
I just don't feel like, it's like every time I try, I just don't feel like continuous, like, sometimes I'm drained, and other times I just don't, like you feel hungry and you go for food. It's like I don't really feel like, paint, although, I get to finish it. That just, the motivation to do it is not there.
Okay. So you tell me you're not quite motivated to get the painting done. What time of day do you tend to work on the painting?
Usually when I come from work, because it's when I get a little bit of time to kind of do it.
Okay.
But again, every time I come from work, I'm always exhausted and stressed with what's going on at work, and so I really try to focus on painting, but it's like, I don't know, like I try to focus, but it doesn't work.
Okay.
So I try, I start, and then eventually I end up not finishing.
You told me in our interview earlier today that you smoked in the morning before you went to work, and then at noon, and then not, when you got home. Do you smoke right when you get home from work? What time do you smoke when you get home?
I usually smoke right after I leave work,
Okay.
and I continue smoking until I get home.
Okay.
So like when I get home, I'm already smoking.
Okay. So you told me, so I'm going to do what Lauren did with her client. So you told me that your motivation, that your energy level is kind of down, and that's after you smoked. So tell me about what's the relationship for you? And don't ask yes. The difficult thing here is I wanted to ask a yes or no question. That's like, the only time you ask a yes or no question is like rhetorical, that you're going to lead right next into something else. You want to try to avoid yes/no questions in motivational interviewing. And in generally counseling in general, you want to avoid. So do you think that your marijuana smoking contributes to your laziness?
I don't know.
Two thumbs-
No, I
two-
don't think so.
2 thumbs down from me. I don't want to ask that because now I just put your defensiveness up because you like smoking.
You just make me mad.
Okay. So I will want to roll with resistance. So let's say I made a mistake there, and I did ask that. Well, what do you feel then when you smoke? Tell me a little bit about what you feel like.
It really makes me feel like I'm in control of everything, like in control of my life, and like not like my boss always controls me at work and tells me what to do. Like I really feel powerful. I feel happy. I don't get to worry about everything else. It's like everything is just perfect and okay. And I always feel like I can do so many things at once. I really get like great feelings.
So you feel really good, and then what I also heard you say before was that you feel really relaxed. And so what do you do to relax?
I just sit and smoke, and like when I feel good, then I can get to watch the movies that I really like watching. And when I'm bored watching movies, then I can just go on the internet and play Farmville. I enjoy playing Farmville. So
it sounds like that when you smoke, you get relaxed and you watch movies and you play on Farmville. That's relaxing. That's everybody likes to be relaxed. So you can paraphrase what you're hearing. I mean that definitely that's okay for you to kind of paraphrase, because the person can stop you in the middle of this. But you want to support self-efficacy, and I'm supporting that this person that we were talking to is getting some benefit from their from their use. That's part of motivational interviewing, and especially somebody that's in pre-contemplation, you're gonna give them some sort of token that you understand they're getting positives from this, but you're also, what I'm doing, you clearly see what I'm doing, which is trying to get her to recognize, or our client to recognize, wow, how often have you painted after you've smoked? That would be, see, now I'm developing discrepancy by the number of times. I smoked one night, I got half the room painted. I was just really motivated. I still think it's my ADHD. You can have a difficult client. I don't know how difficult this client will be. But you want to roll with resistance. Keep asking the questions, and then support self-efficacy. So if this person says, I've only painted once after I smoked, you might have something to that. Then okay, well, we've got something. Well, what's something else? What's another way that you could maybe try to get this done, try to get this painting done? Well, what if I didn't smoke right before when I got home? There, you're supporting their self-efficacy.
When that client said that he, is it possible to be in ADHD, was he trying to say that was maybe the reason he didn't get stuff done, or is he trying to say that that's the reason he maybe self-medicates?
I think he's probably trying to make the argument that's why he's self-medicating.
That's what popped in my mind, but then.
Yeah. I think because his take throughout the whole interview was that marijuana should be legal, and he had the audacity in the interview to say, it's only a matter of time until marijuana is legal here in Oklahoma. And I don't know about everybody else, but Oklahoma is the reddest of the red states, and we're not going to, probably in my lifetime, legalize unless we're in dire economic straits. The Oklahomans are pretty principled against marijuana, so I don't know what cloud he's residing on, but it's not around here. So that's a good question. I think he was trying to self-medicate or stick up for self-medication. So fundamental skills. What does the counselor do? So here's, and this OARS is a very, this will be a test question, this OARS acronym. Skills to use. Obviously, I touched on use open-ended questions almost exclusively, unless you're just really trying to make a point. Affirmations. You affirm, and that's kind of like, expressing empathy. You're affirming that you understand what that client feels like. That he's frustrated that he can't paint his room, or, I feel like it's my fault that he gets so mad. He told me that if I just, had dinner done, that he wouldn't get so mad, and I just couldn't get dinner done. So really, it's kind of my fault that he got so mad and yelled and broke those dishes. So, I hear you saying that you care a lot about this person and you want the best for them. So not, affirming their humanity, but not affirming, their own attribution. If you don't agree with it, don't affirm something that you don't agree with. That's not where you go in this. You're not completely Rogerian. You still have your own goal. You're trying to increase this person's motivation. In that case, to leave or to think about a different environment for herself. R is for reflections. And so that's a lot of Rogerian technique, is reflecting. But then how did I use those reflections? For instance, I pulled in, you said you smoked 3 times a day, and you smoked right when you got home, yet you have trouble painting right when you get home. I'm putting reflections up there. I'm not making anything up. I'm reflecting what they said, but it's in a strategic kind of way. And then S is summarizing, which we haven't got to. Summarizing would be, if, for instance, nice, you got to the point where you said, I see what you're saying about I've only painted one time, and I think that, I'm ready to try something different. And so then I would summarize, well, it looks like you've, or summarizing, well, it looks like you have taken a real hard look at all the times when you haven't painted, and see that the marijuana is connected to it. You could try to summarize. You're not putting words in somebody's mouth, but you're kind of helping them move on into something else. Because then I'd want to move on into setting goals with you on how to decrease that. Okay, so then we go into change talk. When you hear it, what do you do? So Nice said, I think there may be something to this. I've only painted one time after I smoked. You listen for a desire to change. Maybe I need to think about something different. Oh yeah, that's D. So you listen for ability. You listen, number 1, for desire to change. You listen for ability. So have you ever tried to change your use of marijuana before? No. This person would have said no. Then you'd have, because you're trying to build efficacy, the ability. Reason, I need to get this room painted. I'm getting more stressed out by not having the rooms painted. Need, I need to get the rooms painted because my wife's going to leave me unless I get my rooms painted. And then commitment. So those are all change talk. Darn C. I won't necessarily test on those, but that's they love acronyms in motivational interviewing. Okay. Now, these are questions to ask when you're eliciting change talk. These are things that, and so if you're planning to do motivational interviewing for your project, these are some things that you can work on asking your participant or demonstrating. So Lauren, what's the first one on our list here?
Importance and confidence ruler.
Importance and confidence ruler. So nice, how important is it that on a scale of 1 to 5, with 5 being very important, 1 being you don't care at all, how important is it that you get those rooms painted?
Maybe 2.5.
If they don't get painted, it's no big deal. Okay, how important is it to you on a scale of 1 to 5 for you to keep your job?
Which one is the least important?
The
Which number?
least important is 1, and 5 is most important.
I'll say 5 because I really need the job.
That's the
At
same.
least I get paid and I can get the money to buy my joint, so I really need the job.
The person that we were talking about took home about $1,000 a month, and 200 of that was spent on marijuana. So, but ironically, where you went with that, this was of all the goals that they discussed, that was the number one goal for the person to keep their job. So they really, really, really wanted to keep their job, and it was like a 5. It was a 10 on a 10-point scale, but I just used a 5-point scale. So yeah, use that ruler. Test where people are at. Nice. What is the next one up there?
Querying extremes.
Okay, so what do you think about if you're thinking about querying extremes? It's a tougher concept. Go ahead.
I would have said
Yeah.
maybe how far would they be willing to, I don't know, just from looking at that, how far would they be willing to take, to go to, I don't know. I don't know if it's to achieve what they're looking for, or,
Well-
what I'm saying is I don't know, obviously I don't know what it is, but I'm guessing it's either, I don't know.
It's okay. It's okay. It's kind of like you look at both poles. So you say like for instance, what would it look like if you smoked all the marijuana you want every day? What would it look like? And so the guy would say,
My life would be beautiful. Not stress at all.
okay, well, what would you make it so really a person that smokes 3 times a day, they're kind of monitoring their use, or and even let's take a harder substance like alcohol, for instance. Let's switch it over to alcohol. Like let's say that this person's an alcoholic. So what would happen if you drank all day every day?
I
Whoa.
won't be able to go to work.
Yeah, I wouldn't be able to function. What would happen if you completely quit alcohol altogether?
I think I'll be a better worker and I'll have better relationship with my friends and family.
That's the premise here in the querying extremes. It's like you get that person to think about, think about like a perfect world where you could smoke as much as you want, or maybe that's not, don't use perfect world. Say, what would it look like if you smoked all day every day? What would it look like if you smoked nothing? You're basically having them look at the extremes, and then usually you come back to the middle. It's okay to get people to stair step away. If this person is not wanting to go from 3 joints to 0, if they can go from 3 to 1 joint, hopefully you've made some progress, and then you can help them through motivational interviewing. Okay, well, let's look at your life 3 weeks ago when you're smoking 3 joints a day, and now you're smoking 1 a day. What's different? And then that person hopefully tells you, well, I've got more energy. I haven't fallen asleep at work. I got one of my rooms painted. That's the premise. So then you go into looking back, looking forward. Let's see here. What would be a good one for that? Just kind of looking at the past.
Is that like if looking at the past usage, or looking at when I say that, like for our scenario, is it like looking back to when they didn't use, or looking back to
Could be.
first? Or are we talking about looking back to when they first started using?
It could be. It could be both. I mean, if you're looking back to if somebody started using when they're 25, well, what was life like when you were 24? If it was like this guy and he was 14 when he started using, this may not be. And these sometimes don't work with everyone. You don't use all these with everybody. This one may be a tough one to use with this guy because he's been smoking for so long. He doesn't really have a reference without it. So evocative questions, we've already covered some of those. You're evoking, what does it look like in a perfect situation with you? Decisional balance. Decisional balance. It's a good question for me too. I'll have to come back to that one. Goals, values, exploration. That's what we did with, well, what do you want? Well, yeah, I want to keep my job. That's definitely goals and values. And then elaboration. So let's say that she starts to talk about, there might be something to this. Maybe marijuana is connected to me not getting my rooms painted. Tell me more. How do you come by that? Well, you're right. I don't have as much energy. I just relax. You're elaborating, having that person go on and state the obvious. Because when the thing is, if you can get that person to state it, then they own it. They can't really take that back. And that makes changes. By them stating it, it makes changes to their neurochemistry. It makes new connections. They probably have never, you're helping them think this out. Because people in their own lives are judging them, are putting them down. You're just lazy. You don't do anything. I'm so sick of you. So they get defensive. It's fine. I don't care. You're right. I am lazy. And they smoke, and then in the world that folks are in battling addictions, they're in a self-perpetuating cycle. And so we are helping them step out of that cycle by doing this. Responding to change talk. Now, what do I say? Reflect it right back to them. Elaborate more. Summarize it. Affirm it. Now we're moving along. Elicit, provide, and elicit. And then come up with like a menu of options. We're not giving it to them. So it sounds like you could cut back your marijuana use from 3 joints to 2 joints a day. You could go to 1 joint, or you could quit smoking. There's your menu of options. What would work for you? That would be okay. We don't have to we're not putting our values on. We're giving a list of options, and then they choose. So that would be a good thing. Dealing with resistance. Is this really working? So this is a little bit more difficult. Resist the writing reflex. So if for instance, if you're talking to me and you said something earlier that set me cross. Oh, you know what? This is where it was cross with me as a counselor. When you're sitting there saying, I just feel like I can get anything done. I feel like I got all this power. And even though this person puts me down at work, I don't have to listen to them. And it gives me all this power. What do you think I'm thinking about when that person's saying that?
Why, with all this power, then you can get things done? I don't know.
No, it's right.
That would be what I as a counselor, I'm gonna be a bit upset, I guess,
Yeah.
that you get all this power, yet you decide to just sit and watch TV and play video games and don't do the things that are important with all that power that you get. Like, what's the use of smoking it anyway? I don't know. I'll be very upset.
That's right. I mean, I had all those things going through my head. So rather than just say, no, you don't, you're wanting to say, you don't have power. That's flashing through my head as you're saying that. But my reaction was one of, okay, I'm going to take that and I'm going to resist that reflex and I'm going to think of a question after you get done. Because really what you're doing by stating that is you're giving a reason why you smoke. So it's kind of, it takes a little bit of practice to do this, but it's not impossible because it's logical. And so what I'm doing is I'm thinking of, okay, what will be a question that can lead them kind of back on a track where they're not glorifying use, but kind of back here in the middle with me, hopefully looking at both sides. Because if they just go to glorifying use and just looking at that with blinders on, that's pre-contemplation and we got to scale our questions back to that. Understand. So at that point, when you're telling me how much power you have, it sounds like your boss at work is really hard to get along with. It's okay to express some empathy. Listen. You're showing that you're listening and you're empathizing. So if somebody starts to get resistant, come back to that empathy. Come back to, okay, what can I agree with without agreeing that marijuana is a good choice for them to deal with this, or meth, or alcohol, or porn, or gambling, or staying in an abusive relationship. And this works for multiple situations. Remember the 4 values of autonomy, compassion, evocation, collaboration. All right, more options for dealing with resistance. Simple reflections. I hear you saying that you're stressed out about your boss. Amplified reflections. Let's see here. I'm beating a dead horse with the boss thing. Yeah, you have to give me a minute on this. They give acronyms, and it is to help with memory, with what to do. But then sometimes their acronyms, for me, get clouded because they're so close. Shifting focus is a good one. If she's talking to me, and I think I actually did that with you, Nice, when you were talking about how much power that you felt. I think I just switched back and started talking about something else. So tell me about the last time that you smoked at lunch. I'm just going to completely shift gears away from, if it's all we're doing is glorifying, I'm going to shift gears away. Agreement with the twist. So yeah, it sounds like you get a lot of relaxation from smoking weed. What else do you do that relaxes you without smoking weed? So you agree, but then you put your twist on it. Coming alongside, reframing, emphasizing personal control, disclosing feelings. So now, Lauren, you did that with the disclosing feelings. When you said, yeah, I don't get things painted. I've got something I'm trying to paint right now. You disclosed your own feelings. So, the very end of that disclosing feelings, if you get to a complete loss, okay, let's say this person is, I don't know how to rein them back in. At the very end of the day, it's okay to say, you know what, I'm very concerned for you. So let's switch gears to the domestic violence situation. I'm really concerned for your safety because you told me about getting strangled, yet you didn't file a protective order. You told me you almost blacked out. What happens if this happens again? At the end of the day, we're all human. And if all we're doing is just reflecting and trying to lead this person with our questions, sometimes it just comes down to it where, we've got to lay it out there. So that's okay in this deal too. Man, one more slide here. If it's dragging for me, I know it's dragging for you. So hang in there with me. This is a big technique. Traps. Premature focus. So what would be a premature focus in this situation?
That would be probably trying to focus on the main issue ahead of time. Like when you're not really supposed to focus on that issue, probably going on the final stage when you should be helping the client be at the pre-contemplation stage, I guess.
Yeah, so like for instance, if you're trying to get them to cut back and you haven't established rapport yet, so tell me what you're going to do to cut back from 3 joints to 1 joint a day. Well, I'm not going to do you. Yeah, you're right. You're right. Premature focus, labeling, avoid. We get into this context of calling people addicts and alcoholics. Avoid labeling, if you can, in this technique. If you're trying to get somebody to work with you and it's in the beginning stages, please avoid that. Answering. So if you're answering your own questions, what is it like when you smoke pot? It's like you're lazy. That wouldn't be good. Confrontation. Lauren was a little confrontational with her client battling with weight, but she did it in a good way. The first time was not MI. Well, I can't remember what she said, but it was.
I didn't do it that
You're
way.
you're gonna die if you keep eating.
I didn't really do it that way. Yeah,
Okay.
but that's what I said. And but in reality, I just called him out as far as telling me one thing,
No, you reflect. You used a good reflection.
doing something completely the opposite from what he's telling me he wants.
You used you were using MI and didn't even know it. Confrontation. Do you want to keep your job or not? If you keep smoking marijuana, you're going to lose your job. That's stating the obvious. We may want to do that, but that's not MI. Being the expert, marijuana decreases IQ. The more that you smoke, the lower that your IQ. There's so many studies that say that. There's so many studies that say, and that's where our person went today with it, was marijuana creates a motivational syndrome. And so it sounds to me like she is being the expert. That's not what you do with MI. You don't be the expert yet. And blaming, obviously you don't want to blame someone. No, if you wouldn't smoke, your relationship would be better. Your job would be better. You'd have less stress in the long run. You want to say that, but you don't. So what do you think? That's MI, and I've zipped through it, but it's a big topic, but it's almost like second nature once you start to use it. It becomes somewhat of an art. Well, I'll tell you what, let's take about 5 minutes to get a second wind, and we'll probably go another 20 because there's about 3 handouts that hopefully will help you implement this if you're ready or if you want to, and then we'll call it an evening. Okay, we're back, and so we're going to talk a little bit more about motivational interviewing and resources for motivational interviewing. So if you put in a search engine, motivational interviewing, and take it off of images, so you actually can get some websites, you'll notice that there'll be a motivationalinterview.org. This is by the actual folks that developed the theory and the technique, Miller and Rolnick. And so you can see there's things in here for trainers, for treatment directors, educators, and clinicians, and also clinical supervisors. So I'm going to click on clinicians, and you'll see over here on the left-hand side of the page, there's a place for skills and tools, self-assessment, and info about evidence-based practices. So let's look at skills and tools. And so you'll see 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. You will see 11 different resources here for you to pull down and actually use. Like this summarizes the types of change talk, methods for evoking change talk, and ways of rolling with resistance. I'm going to disseminate a couple of these for our class. Here's motivational interviewing and stages of change, our 2 topics. So go ahead and open this up. Possibly. Oh, this is actually one of the forms I have for class. So let's go ahead and use that one first. So I'll go over here to my files. Okay. So what it does is, in this page here, it says motivational interviewing procedure and stages of change. And so looking here, using the stages of change to help move the client through the change process. So on the left, you have the stage of change listed. There are the 5. And then you have some characteristics to help you identify if the client's in that stage of change. And then you have techniques listed to help guide you on how you should approach the client. So we've already done this. I already did this a little bit with our stages of change. So this is like a 3-page document here. You're welcome to work through that. And another resource that I'm offering on the Blackboard is this example of an MI session. So, number 1, Lauren, what do you want to do? Number 1 in an MI session.
Set the agenda.
Right.
And the target behavior.
Okay.
So using smoking exercise.
So with your client, yours was actually drinking, and a binge drinking. So you set the agenda for your client that we talked about in the break. What's the next thing that a person should do? Nice.
I can see.
Oh, okay. Here, I'll make it a little bigger. I'm sorry. Number 2. Oh, I'm sorry.
It's okay. It's a good exercise for me. Ask about the positive or good things, aspects of the target behavior. This is often an engaging surprise. However, it will only work if you are genuinely interested.
Okay. Thank you. When you are writing objectives for people, when you're right up front writing goals and objectives on treatment plans for substance use and addictions, you do want to include one line about list 5 benefits of using, or 5 benefits, 5%. A good way to phrase it for insurance would be 5 perceived benefits of using, because you're wanting to. on some level, you want to not advocate, but you want to show the client that you understand there's a reason why they're doing this. You want to express some empathy. You want to understand why they're doing this. This can be invaluable if you find out, like we did with the guy that was smoking weed, that he's just really anxious all the time, and that's the number one reason why they're using. What are you going to do then in your therapy?
Sorry, I stopped there.
That's okay.
But what I caught the tail end of was if he's using it to decrease anxiety, what are you gonna with his anxiety, and then what are other ways
Absolutely.
you could bring anxiety down without using
Replacement activities. Replace what they're getting from this. So seeing why they're getting benefit. You're actually getting something very invaluable for your counseling. So if you started this with, you just need to change, you're going to miss some really valuable insight with how to get this person to change and change in a healthy way. And then you come right back with number 3, Lauren.
I'm going to ask about the negatives.
Yeah, ask about the negatives. So you help them weigh them out. Number 4, nice, I'll get this one for you since it's up. Number 4, you want to explore life goals and values. So this person, his goal was to keep his job and he really valued his family. So now you're digging in, you're finding ways, okay, now I'm finding ways that I can potentially motivate this person to change. Then 5, ask for a decision. Restate their dilemma or ambivalence, then ask for a decision. So it sounds like you really value your family, and it sounds like you really value your job, yet if you continue to smoke, your employer said you're going to lose your job. What are you going to do about that? That's MI. Because hopefully you've motivated something from that. And this is specifically on, I will use this page for our test because this went to what I spoke about tonight. Number 6 is what, Lauren?
Goal setting.
And use what?
The SMART acronym goals.
And use SMART goals. Specific, it says meaningful, I say measurable, accessible, realistic, timed. If no decision or decision is to continue the behavior. So now it always can be, remember, in these sessions, well, you know what? I'm going to keep smoking 3 joints a day. That may not be satisfactory for you, but we have to accept that. If no decision, emphasize with difficulty of ambivalence. Ask if there is something else which would help them make a decision. Ask if they have a plan to manage not making a decision. Ask if they are interested in reducing some of the problems while they are making a decision. If decision is to continue the behavior, go back to explore the ambivalence, if you found any. So yeah, let's keep that example of an MI session. That will help you. And there you go. If you're going to choose MI for your class presentation, you got an outline of a session right there.
Yeah.
Woo!
I think I'm picking that one already.
Let's see here. And then last but not least, we'll pull up 10 strategies for evoking change talk. Evocative questions, open-ended questions, we know about that. Elaboration. Ask for examples, we didn't cover that. Looking back, we did talk about that. Looking forward, talking about extremes. Oh, here's what their example of extremes were. What are the worst things that might happen if you don't make this change? I could lose my job. What would happen to your family if you lost your job? I might lose my family. You can keep going with those questions. what are the best things that might happen if you do make this change? I could keep my job, I could keep my family. And now you've got, those are their goals. So hopefully you're getting some more motivation asking them this stuff. There's the change rulers. Oh, change ruler, that's a little different than what we talked about. How much do you want to change your use of substances right now? Nice. 1, not at all. 5, 100% want to change it.
1.
Oh no, I didn't do a very good job tonight.
It makes me feel good, although I may need to do a lot of changes to keep my job, but right now I don't really want to.
Okay, well that's you have a right to be at 1.
At least I'm honest.
At least that's right. You want honesty. Explore, and so I'd go try to explore some more ambivalence if you were at a 1. Explore goals and values, and then come alongside. So here's what they say to come alongside. Perhaps it's so important to you that you won't give up no matter what the cost. It may not be the main area you need to focus in our work together. I'm kind of lost on that. Explicitly side with the negative side of ambivalence. Oh, I see. Okay. Perhaps smoking weed is so important to you that you won't give it up no matter what the cost. Ooh. I could say that kind of sarcastically. I'd have to watch how I said that because I could be pretty sarcastic with that. I do like this though.
Okay.
It may not be the main area that you need to focus on in our work together. So maybe next, because I didn't get a change from you, are you only going to be at a 1? You know what? Would you be willing to work on your anxiety?
Yes.
Okay. So that would give us something then, even though you've got no change, the person's going to smoke 3 joints a day from all week until we see each other again. You at least got something you can come back together and work on. That's sometimes all we can do. So what do you think? Motivational interviewing stages of change. On a scale of 1 to 10, 10 being I understand it completely, and 1 being I'm completely clueless, where are you all with motivational interviewing and stages of change? I would like a number from Lauren and Nice, please.
9.
Okay. Lauren says 9. Lauren says she gets it. Where are you at, Nice?
I'll say 8.
Okay.
For me, the practical part of it, because it's like with me, I have to really practice more and more and more in order for me to get it, or for it to be like, a second skin for me. Because although the way you explain it is really clear and easy to understand, but again, when it comes to applying it with a client, it becomes a bit difficult, especially when the client has a different kind of issue they are dealing with. So that would be the difficult part for me, just being able to apply it on a client who comes with an issue that that is different from alcohol addiction, or something that you can apply those 5 steps with and get to help them at the end. Because right now there is a client who came to see me, and he's trying to figure out whether he should stay in the US or go back to his home country when he graduates from school. As much as he loves the opportunity in this country, he's also afraid about the shootings that are happening constantly at schools, so he doesn't really feel safe compared to his home country where he is safe, but at the same time, he doesn't have all the opportunities. So with that kind of client, it's gonna be hard for me to be able to, I really have to take enough time to kind of know, okay, how can I apply this step on this kind of client?
Yeah. It sounds like that person would significantly benefit from just cognitive behavioral therapy. That the belief that, okay, well, something's going to happen to me. How many students have been, going to school and not seeing a gun, not seeing anybody get shot? How many college campuses are there in the United States where they have, thousands of students? We have had some things happen recently, and even on the Norman campus there was a scare of OU. They said they didn't find anybody, but it's still they had the part of the campus on lockdown. So does your client speak English well, or are they still more in their native tongue?
He does speak English well, and like his first issue was the shooting.
Okay.
And so I tried to educate him a bit about, every society has its own issue. Here the issue is not really the killings, the issue is the gun control, and that comes from something different. So
Yeah.
I tried to explain to him that, and then he went from the killings into religion. He doesn't have the freedom to practice his religion as he has it back home.
Yeah.
And so it was like he was unveiling one issue after the other.
Yeah, it sounds like you had a whole host of issues to work on there. I can't say that Oklahoma. There's a statistic I heard. We've actually got more people in the United States now, but a few years ago there were 311 million guns and 310 million people. So there was one gun for every. So for gun control, there is no such thing here as far as that goes. And then, for our Constitution saying freedom of religion, Oklahoma is not that. We did pass a law that said that Sharia law is illegal to be, and that's. I think we violated the Constitution of the United States by favoring one religion over the other. But that's how we do it here in Oklahoma. So we're pretty scared people, unfortunately. But anyway, well, yeah, the MI may not be completely appropriate for every case, but it is applicable. And you do have a client with some strong ambivalence. He's in a contemplation type situation. So, well, ladies, thank you for entertaining me tonight with participating and going along with me. And we'll continue this next week. And next week we do have the books on tap. So please bring your texts. And these will be information very valuable for the NCE, for the National Counselor exam, and for your comps. And so that's why I include it. I want to make sure that you do. Some of these other things it'll be interspersed. Miller and Rolnick will probably be on the NCE. Prochaska will probably be on the NCE. Some of the others that I talked about earlier on. But we'll go into specific theories that are 100% on your tests. So it may not be the most riveting sessions, but we'll get some good information out of it nonetheless. Okay.
I have a question.
Yes.
Sorry.
No worries.
I just wanted to know if it's possible for us to get a feedback from you whenever you receive our journal entries.
Okay. Let me check and see what I have. Okay, so this is for the alternate posting for being able to submit the journal assignments. So log into Blackboard. And then when you log into Blackboard and you go into Addictions and Family Counseling, what you'll want to do is you'll want to go to the discussion page. Okay, so what I've started on the discussion page is I've created a forum, and what it says is alternative for email journal entries. So for those of you that are having difficulty, please go ahead and create a thread and put the date of the journal entry for, I'll put sample so you'll know, sample journal entry for 2/13, and then put the class date, and then this is an example of an alternative way of posting the journal entries. And then that way, we don't have to worry about emails. It'll just be posted on Blackboard, and it saves the date and time. So that's an alternative too. And please just go ahead and submit.
Can I be able?
Pardon?
Sorry.
Go ahead.
On Blackboard, can I just attach the journal? Because usually I type my journal using the Word.
Here's
So on the Blackboard, can I be able to attach it rather than type the entire journal there?
Yeah, nice. It was at the bottom there. When he scrolled down before he posted it, it was at the bottom to attach.
Okay.
and if you can't do that, let me show you a trick that will help you in all classes. Okay, what if I take this and I select this, or let's say I want all of this information. I can press Control A, and that selects everything. Control A means control all. Control C copies it, or I can select copy here. And then I can just open this window, press reply, and paste. And then that just put that whole document.
Yeah, I tried to do that in one of my classes with Dr. Lindstrom, and it didn't go through, and I lost a few hands on that, so
Okay.
I tried not to go with that.
Okay.
Because it cost me a few grades.
Okay.
But I
Let me.
will try to see if I won't be able to attach it, then I will just type the whole thing.
Okay. Let me see if I can. So if I'm going to go in here to post, I don't see where she can attach anything.
It wasn't when you did the original. You'd have to pretend to start
Like
anyway.
create a thread.
Yeah. And it should be down.
Oh yeah, here's where you can
Attach
attach a file. Okay. So yeah, that'll work.
Awesome.
Okay. So I'll put a reminder on the front of our page here.
So you haven't received any of my journals at all?
If you didn't get a reply from me, no.
Because I sent them
my
to
last
the.
You did?
I think so. I didn't reply.
I don't know. I don't know.
I usually reply.
The school email that you have, the GT Randolph at nwsu.edu is the one I've been sending, because the 580 that you gave, I tried once and it didn't go through, so I used the second one
Okay.
you've
Okay.
been using to communicate with us.
I'll check the Northwestern one again. Subject: journal submissions. Alternative. Please check the discussions link to post your journal entries if you have difficulty emailing. Thanks. Okay. So that's posted up there to help. Okay, so that's up there on an announcement too. All right. Well, okay, everybody.